you for joining us tonight for our inaugural kickoff with the Bounce Coalition. And at OVEC, we are very excited about the wonderful possibilities to provide assistance or to assist our staff and our students and families in addressing and dealing with the multitude of stress and trauma that certainly all of us are experiencing. And I know it's been particularly hard on educators to try to navigate the waters of the pandemic. So we look forward to our partnership with Bounce and the numerous supports that we will all be able to offer our school districts as we forge this partnership. Again, we're very excited about it. And just a little bit about OVEC. I think most of you probably know, but we're an educational cooperative, one of 8 in Kentucky. And we cover this area of the state, Louisville and surrounding counties, about 15 member districts. And we provide all kinds of services that our districts are interested in. And we certainly know the area that we're going to discuss this afternoon is very much on the minds of educators and the employees of all of our 15 school districts. So to kick it off and to get it started, I'm going to turn it over to Dr. Joe Bargione. So Dr. Bargione,
thank you, Dr. Thank you, Dr. Moonhan. And it's so nice to see many faces on our Zoom meeting this afternoon. I am Joe Bargione, and I'm a school psychologist by training. And for much of my career, I was the lead psychologist in Jefferson County Public Schools. And since I was fortunate enough to retire a couple of years ago, I've been doing a good amount of work with the Bounce Coalition. And we help organizations, educational institutions, healthcare organizations, social services, out-of-school time providers to become more trauma-informed to better support our kids who experience ACEs events and trauma in their backgrounds. About a year ago, we created a partnership with the Kentucky Youth Advocates, KYA, and they're kind of like our backbone program, our backbone organization. So we're very happy to have them be part of us. Actually, and talk about KYA, on the call with us today is Carly Mosby, who's a policy advocacy analyst with KYA, and then Shannon Moody, who is a senior policy advocacy director. And they are going to be the tech people today. So if you're having any difficulties seeing the movie or any audio, please put that in the chat box and they'll try and address that. Because we're a large audience, I think we're close to 120 people. We're not going to be able to answer individual questions or like unmute people. Unfortunately, we're not going to do that. But as we're going through the movie or during the panel discussion, if it generates a question or a comment you'd like to make, please put those in the chat box and we'll be tracking those. And then if we have time after the panel discussion, we'll try and address any questions or comments you have this afternoon, either at the movie or the comments from the panelists. So here's the housekeeping. In about 2 minutes, we're going to start the movie. The movie's called Resiliency, the Biology of Stress and the Science of Hope. It was created by Jamie Redford, who's done a number of documentaries, and he did Paper Tiger, if any of you folks remember that. That was a few years back. So the movie's about 55 minutes long. We're going to show it this way, but if you're having some difficulty, I know we have some people, you may have some connectivity issues. We're also going to put a link in the chat box. So if you're not able to watch along with us in what we're doing with the movie, you can go to the link in the chat box, click on that and watch the movie. As I mentioned, the movie is 55 minutes long. When the movie's over, we're going to come back together as a large group, and then we're going to have a panel discussion. And we have 2 wonderful educators with us today to give us an educator's perspective. Superintendent Ford. Michael Ford is the superintendent in Russell County Public Schools down in the beautiful part of the state, Lake Cumberland. And then also with us today is Brian Brentlinger. Some of you folks may know Brian. He's the mental health specialist in Gallatin County. And then the other two folks who will be on the panel with us today are Dr. Julie Mitchell, who's a pediatrician with the Smoketown Family Wellness Center. And then also Gloria Barry, who works with 7 county services. Because I was so excited that we have both educators and community people on the panel, because we know trauma doesn't impact kids just 6 hours a day, 5 days a week when they're with us in school, whether it's virtual or in person, but it impacts them 24/7. So having those community partners as part of the panel discussion, I think it will give us a richer conversation. And as you go forward in creating your trauma-informed teams, I encourage you to think more globally and not just the resources within your school walls, but also your community partners. You'll create better plans and better supports for your kids. So in just a minute, we'll go to the movie. The movie's 55 minutes long. When we come back, we'll begin the panel discussion, and I'll give you a little bit more of a bio on each of the panelists. So with that being said, Shannon, if you would do the magic and start the movie for us. Okay, so hopefully everybody was able to see the movie using this, the setting we had in place for that. So I just want a quick housekeeping piece again. I know a couple people made some comments in the chat box. Please continue to do that. We'll be monitoring that. Or if you have any questions, as I mentioned earlier, because we're a large audience, if we have time after we do our panel discussion, we'll try and answer some of the questions from the chat box. But we're not going to be able to answer questions if you ask, if you unmute yourself. So please keep yourself muted. Earlier, I talked about, we have 4 great panelists. We have 2 people who work within the walls of schools. Then we also have 2 community partners who also work with children who've experienced ACEs and trauma. So let me give you a little quick introduction, a little bio on each, and then we'll get into the panel discussion. First is Michael Ford. Superintendent Ford is in his 8th year of his superintendency in the Russell County Public Schools. Prior to that, he wore a number of hats within the school system, starting with as a special ed teacher, dropout prevention lead teacher, exceptional children program consultant, and assistant superintendent, and then finally the superintendent since 2013 in Russell County Public Schools. As a superintendent, all you folks know as educational leaders, it's a 24/7 job. But when he does have spare time, he's active with his church and serves on the board of the Russell County Partners in Prevention, which is an anti-drug and alcohol abuse coalition. And he also serves on the Russell County Chamber of Commerce. Our other person who works within the boundaries or the walls of a school, Brian Brentlinger. Brian is a mental health specialist with the Gallatin County Public Schools. He earned his master's degree in both clinical mental health counseling and addiction counseling. And his main clinical focus is helping students overcome various traumas they have endured. Brian is trained in both accelerated resolution therapy and trauma-focused cognitive behavioral therapy. Before becoming the mental health specialist in Gallatin County, he served as the youth center coordinator in that district for 6 years. So those are our school-based folks. Let's tell you a little bit about our community partners who are also trying to address ACEs. Our third panelist is Dr. Julie Mitchell, who's a board-certified general pediatrician and works at the Smoketown Family Wellness Center. She's excited to be part of that team at the Smoketown Family Wellness Center to engage in its vision of holistic care that promotes resilience in children and families. She believes in an integrated behavioral and emotional health care model that addresses childhood adversity as well as family strengths is important for journaling with her patients toward wellness. I also think we have Dr. Charlotte Stites on here. The Smoketown Family Wellness Center, every time I see this movie, at the end of the movie, they show that youth center in the Bayview area of San Francisco. They're doing similar work in the Smoketown Family Wellness. So thank you, Dr. Mitchell, for what you're doing there. And then our fourth person, our collaborator who works in supporting young people is Gloria Berry. She's a licensed and marriage family therapist. She is the director of marketing for 7 county services. For many of us, they're our mental health provider, our mental health center for many of our counties for folks today. They're also affiliated with Bellwood and Brooklawn. Gloria spent 27 years of her professional career working in behavioral health, addiction treatment, and developmental services. She brings an understanding of building effective partnership development, customer service, people-centric nature, and compassion for others in connection with therapy and business development. So I'm excited to have these four folks with us today and kind of give us perspective of what they're doing within the school boundaries, within the school walls, but also as community partners, because we have to do this in a collaborative way. So we're going to start with our school-based people first. And so Superintendent Ford, you're up first. So if you would unmute yourself. And the first question for you is, as the school superintendent, what are 2 or 3 takeaways from the movie about ACEs and trauma from your perspective?
Okay, thank you, Dr. Barjone. It's great to be with you all this evening. Of course, we're fortunate in Russell County. We've been working with Dr. Barjone now for soon to be 2 years. He's been putting up with us, but it's been great. And but we've not done it alone. Our Lake Cumberland District Health Department has been great partnerships, and a lot of other entities have been with us on that. But you know, I was sitting here thinking again, and this is I don't know, maybe the 4th or 5th time that I saw the video, and you can always have, there's always takeaways. But I was sitting here thinking this evening, you know, if I had a family member that I knew had a 50% chance of, let's say, heart disease, I would absolutely be working with that family member and coaching them and helping them. But yet we have ACE studies that show us the higher the number, that the outcome is less, you know, favorable, and a greater percentage of all of these different, not only health outcomes, but certainly psychological and mental issues as well. And I don't think we always look at it with the same lens. And, you know, sometimes my background's a special ed student or teacher, and I think we always kind of get closer to our students and families with that background. And to this day, when I see that list of ACE, I see kids' pictures in my mind, and I know all of you all probably on this Zoom call this evening probably do the same. But, you know, those ACEs can be, you know, we can have one big traumatic event, you know, a child, Lord forbid, can be sexually abused, and that puts that score, you know, but I think oftentimes it's a cumulative effect, and the physician talked about that, and then, you know, students mask those things. But, you know, you think about the middle income, middle household family, maybe the mom and dad, they got a divorce, maybe as a result of that divorce, there's some financial strain, and then, you know, maybe a grandparent passes away. And so, you know, real quick, the ACEs start adding up. But what's so different about that, and as it brought out so well in the video, it doesn't have to be gloom and doom if there's the infrastructure in place and the strategies and all of that to take care of that. So that's what I think is so important, especially I think about rural Kentucky and Russell County. Educators cannot do that alone. And Dr. Barjone mentioned that at the very beginning, and the community stakeholders are so important as part of the piece of the puzzle in making all this work. And, you know, Joe, you mentioned at the very beginning, we've got them 6.5 hours, 7 days, you know, 5 days a week. But all of those things come into play. But without those supports and without educators mitigating it or outside entities, you know, it can easily become that toxic environment that this video was so noted for on dealing with that. But it takes a skill set, and it takes that intervention to get through with it. And so we've been really blessed with having that. And Joe has always talked a lot and mentioned this, and I think it's important to use common terminology, but what happened to you instead of saying what's wrong with you. And so if you have that mindset and you see a child and think, you know, wonder what's happened to that child, that's different. And you can think about a distressed child or a stressed child versus a problem child. And so a lot of those takes away in the video. And I know I saw in the chat, many of you all were noting that, you know, it's the best video you saw addressing ACEs, and it really is, because it lays that foundation. But, you know, I guess I'll close with this, but what kind of, like, you know, again, what are we waiting for when we know that the children have a high number of ACEs, or we can click this off, because that prevention is certainly greater than dealing with the effects of it.
Thank you, Michael. So next up is Brian, our other school-based person. So Brian, if you, I see you're unmuted, if you would maybe give us a couple of comments from your takeaway from the movie.
Thank you, Dr. Barjone, and thank you guys all for being here. It kind of warms my heart seeing so many educators taking some time outside of school and different community people to really learn about this. And when I watched the movie, I've seen it several times, like Mr. Ford had talked about. And every time it's easy to kind of see all these things and see all these health outcomes that can be affected by ACEs and almost get overwhelmed. Like, how can we make a difference? What can we do about this? And I love in the movie how it talks about resilience, and it talks about how resilience isn't something that we're born with. It's something that we learn over time. And as someone that is in the school all the time, we are surrounded by adults that can care for kids, and they can teach them how to be resilient. And I know Dr. Barjone has been working with Gallatin County probably for right at 2 years as well in training our teachers, training our cafeteria workers, training our bus drivers. If just all of those people can help work with our kids, what can we help them get through it? And that's one big thing that we, each and every one of us, can make a difference every single day in a kid, just by being there for them, being that supportive adult that they truly need. And then I just come to the fact that the more people know about ACEs, the more someone can say, oh yeah, I know what an ACE is, the more we can make a difference with our kids. The more people that understand what trauma is and understand how the little things that we do could re-traumatize a kid, the more we understand those kind of things and we do everything we can to make sure that we're not doing that, that's helping even more kids. And as we learn more and more and hear more and more, I'm just excited to see how all of us, even here in Gallatin County, just ways that we're working with the kids and making sure we're not re-traumatizing and going back to the what happened to you and not what's wrong with you has been huge for us. And I love the movie. I could probably watch it 100 times and get something every time, but those are the kind of things that jumped out and spoke to me today.
Thank you, Brian. So now we're going to talk to Dr. Mitchell to give a perspective from a pediatrician. Dr. Mitchell?
Thank you. Number one, the power of prevention and early intervention. So the film highlights the 10 ACEs defined by that initial study in the 1990s by the two doctors, Felitti and Onda. However, we know now that adverse community environments have the same detrimental effects on children's developing brains. Poverty, food insecurity, housing instability, racism, all are deleterious to children's health. So if we address those social factors of health, we are also impacting the long-term health outcomes and also success outcomes of children. Success outcomes being educational attainment, job readiness and retention, income acquisition. Number two, the underlying precipitants or at least aggravators of physical complaints may very well be emotionally driven, stress-induced, or trauma-related. So from a pediatrician's perspective, it's important for me to delve into that history of, has anything bad, sad, or scary happened to your child? Are you or another adult worried about your child's behavior? And third, pediatrics is at least a 2-generation science, if not 3, in cases where grandparents are the primary caregiver. Therefore, we can't only look at the child when we're thinking of the child's health. So building upon the caregiver's strengths is important, an important aspect of resilience, and building that rapport and trust to provide optimal care for children and holistic support for families.
Thank you, Dr. Mitchell. And then Gloria, you're up next.
All right, thank you, Dr. Barjone. You know, the first thing that came across to me is the importance of us all on this call to know our own ACE score, to take this exam ourselves and know where we're coming from as we are there serving children in the community. And take a look at where our resiliency comes from, where, you know, how we were able to overcome traumas that we faced in our early years. So I think that was a huge takeaway for me. And I think somebody had put in the chat earlier about they wanted to take that questionnaire, and really all you have to do is Google Adverse Childhood Experiences Survey, and you can do it right online and get your score. another thing is I really liked the Miss Kendra list and them going over that list and really instilling in those children the ways they should be protected and cared for. And one of the things that came up in the list is that no child should be touched in their private parts. And that's a big education piece also for parents, is just teaching them to name the private parts with their children and not feel embarrassed about that or insecure about that, that is a powerful tool they're giving their children to know the names of their private parts and what private parts are. As a young clinician, I remember talking to kids about where they wear their bathing suits and that covers their private parts, because I'm not their parent, but just having those open conversations with parents is really important for all of us to be doing as well. And I really appreciated seeing Dr. Burke Harris and how she talked to parents in her pediatric practice about completing the survey. I work in mental health, and I would, as a clinician, I would want to know what the traumas are. But if I had a family that was resistant, I would definitely, or a parent or a guardian, I would want to take that same approach as, I don't need to know what they are, but I do need to know the score so that I can help you as I'm building a relationship. And then hopefully, as you continue to work on building that relationship, they'll feel more comfortable to share what those traumas are. And then you can get in there and really work on the resilience piece and uplifting parents' capabilities and them being the strong parental buffering factor that will make a difference.
Okay, thank you, Gloria. Before I ask the second question to the panelists, I've seen this movie many times, similar to what Brian, and I always learn something new. But two of the statements made during the film really kind of stand out to me. And the first one is, the child may not remember, but the body never forgets. I think that is so telling and so truthful, especially for our young kids, right? And we know with ACEs, it can go the long-term impact into adulthood. If you have 6 or more ACEs events as a child, on average, your life expectancy is going to be 20 years less than someone who didn't have any ACEs events in their life, right? So the body never forgets. That's the first one. But the second comment that's also made, I think, is really important for us as educators, whether you work directly with kids, if you're a teacher or a specialist or a school psychologist, school social worker, or a school counselor, or you're in administration, you're a principal, you're the superintendent or assistant superintendent or director is, going from, it's a mind shift, a change in mindset, going from what's wrong with you to what happened to you. If we knew a little bit more about that child's upbringing and the things that are going on, those ACEs events, would it change the way we interact with that child who may be being defined in class or being oppositional or being a behavior problems, whether it's at the elementary level or at the middle school level or high school level? Some of those young people who are having difficulty with regulating their behavior and their emotions, and that we're going to discipline. If we knew the backstory on those young people, I think we would probably react differently to the way we're handling those young people. And it's a journey, folks. To become trauma-informed as an organization, you got to live and breathe it. And just not a compliance issue. So those are the two quotes that really kind of hit home to me as a person who worked so many years in the school system. Going from the child may not remember, but the body never forgets. And then going from the mindset of what's wrong with you to what happened to you. So the what happened to you is the piece that I want to kind of cover next in the question for the 4 panelists. Now that we know this information, and you're trying to move forward in your organization, whether it's in school districts or health organizations, whether it's behavioral health or physical health or integrated health, one or two things, a takeaway from the movie, or some of the ways you might change your practices or the things that you do to support children and families that you work with every day. So we'll go through the same order again. We'll start with Michael Ford as the superintendent. What are 1 or 2 things that you will be doing? You might already start doing some things differently, but what are 1 or 2 things that, based on what you've learned from the movie and your own research, that around ACEs and the impact that has on young people, how it might change some practices or things that are going on in your school system.
And Brian noted this on the first round of questions. Number one, I think it's so important with the training. And we talk about that trusted adult. Every student needs that trusted adult. Every person needs that trusted adult that can mitigate this toxic stress. And so that might be that bus driver that greets the kid every morning. That might be the cafeteria worker, instructional assistant, custodian, teacher, whomever, coach, whatever it is. And so training for everybody, and it's not a one and done, and you need to commit to that and go along with that mind shift. But also with that, as we're having that training, I think we have to be really mindful that we have to take care of the people that are taking care of our people. So our faculty and staff, they're also under a lot of stress. And as they help our students and they mitigate our students, and, you know, I was talking to one of my assistant principals the other day, and she was just tired. It'd been so many different home visits and working on a lot of tough situations. And we just started back on a hybrid schedule on this Tuesday. But prior to that, she was just running herself ragged, doing a lot of home visits. And, you know, she was mentally exhausted. And so we have to be really cognizant of that as you work with a population of students that are high risk and have high ACE scores. You're not at your, you know, you can't help them as well if you're not supporting yourself. And Dr. Barjones, that's something else he's done with our faculty and staff, is some self-care training. So I think that's so very important. And again, just letting people know that it's not a end all be all. As we talked about that gloom and doom, it doesn't have to be that way. There is light at the end of the tunnel, and that goes back with that training. I mentioned earlier about that common terminology, and I think it's important that our community starts to hear this and hear it more. And we've done training in our communities and in grandparent support groups and things like that. I really like that billboard that was in the video, and we have some up in some public service announcements in Russell County. And I don't know if that needs to be one of them to get that word out, and people take that, as you all, some of you all have already noted, if you take that ACE survey and you find out your own ACE score and what that means to you, then you can, you know, visualize and put that on with some other students. So the education out in public, in the public at large, and, you know, KYA does a lot of advocacy group work. And I was just thinking about talking to the legislature, and don't know necessarily the process of this, Joe, but the requirement of the ACE screening as part of the well care, or, you know, that the physicals that children are required for preschool, kindergarten, 6th grade. You know, why is that not part of the ACE screening, part of that? And so the regulation revolve around those screenings that's already required, and maybe getting that incorporated as part of that. So all those things, there's always, you know, we talked about in the video, you learn something new, and there's always, I've got a list of things right here I want to talk to some folks about after just reading the chat and watching the video again. But there's always more to do. But I think training, if I'm going to have one thing, it's that continuation of training and having the tools in the toolbox to deal with and help our students.
Thank you, Mark. I think you make some good points, you know, and it's really it's about building resiliency, and what can we do as educators? And then you're talking about policymakers, and it is, everybody in the community needs to be involved, and the legislators from their perspective. And I can tell you, in 2019, when they passed the School Safety and Resiliency Act,
yeah.
Okay, so they recognized at the policy level, it's about resiliency. We want to keep every child safe, right? Whether it's physical safety or psychological safety. But really what we want to do is build those resiliency skills. So they did recognize that, and there's some language in that bill that schools have to comply with, like developing your trauma-informed care teams by July 1st of 2021. Now, the important piece there, from my perspective as a school psychologist, is it's about building that resiliency within that child, within that family, within that school, and within the community. So I think you make some good points there. So Brian, you're up next.
Yeah, thanks, Dr. Barjone. You know, when we think about things that we do differently, I can think of a slew of things that I've started to do differently in the last several years after understanding trauma a little bit more. But I know one thing here in our district at the middle school and the high school level that we've done a lot with is looking at our behavior issues and some of the students that are getting in trouble, and moving from that, what's wrong with you? Why are we acting this way? To, what happened? Why are we doing that? And I have a story that just happened today that 2 years ago probably would have been a lot different, but we had a kid is in his English class, freshman English. They're reading a book, and the teacher calls on him to read, and he gets up, he slams the book down and says, "I'm not reading," and leaves the classroom. I happen to have my door open. I kind of hear what's going on. The teacher, I look out and I just kind of give the wave, like, "I've got the kid. Let's see what's going on." So I call the young man in. I'm like, "Man, what happened?" Going again to that "what happened" question. And him just sitting there, and he starts crying. I'm like, "Okay." And him being able to tell me, we're coming up on the anniversary of his brother dying 11 years ago in a car wreck. And the book they're reading is about a 17-year-old who died in a car wreck. So we would have had no idea what was going on with that young man. We probably would have suspended him a year ago for being disrespectful to the teacher, for leaving class. We didn't know where he was going. But because now we kind of understand how important it is, we take the time, we ask the young man what happened. And now, honestly, we can start to do some good work with him. We're going to start to give him a new book to read, because obviously this is too much for him right now. And we recognize that. We're going to work on making sure that we do everything we can to support him with some trauma counseling and those kind of things. Because he said, "I never dealt with this. I was 3 years old when this happened. I didn't even realize it affected me this much." So taking time and asking that "what happened" question is just huge. And then a lot of what, Michael was talking about, our staff are dealing with a lot. And when I came into the school, my main focus was, I'm going to do everything I can for the kids. And I didn't really worry about anything else but the kids. But our staff are hurting. Our staff have so much going on. And a lot of times they have ACE scores that are through the roof, and they've never dealt with their own trauma. Yet we come in and we tell them, "Well, you've got to understand this kid's trauma." And they don't know how yet, because they haven't dealt, or they don't even really understand their own trauma. So now, this week I've worked with 2 staff members with some traumas that they're dealing with, because we all kind of recognize together how important that is. Let's take care of each other, adults, kids. Because I know if I can help an adult, they're going to probably help 30, 40, 50, 60 kids. So understanding this is not just we're going to help our kids. This is we're going to help our whole entire family here in our school system, which has been just remarkable, honestly.
Yeah. And Brian, I think you make some good points that, we as educators, we always focus on the kids, but I appreciate you and your school district focusing on the adults, because, if they're going with the pandemic and NTI and all those other issues. That's on top of, they may have had their own experiences with ACEs as a child. So giving them the resources and the tools will make them better, because two of the things we're sometimes seeing with some of our adults working with kids, we have compassion fatigue, right? When you're working with a group of kids day in, day out, you may lose your compassion towards them and empathy. But then also some folks experience that secondary trauma, right? And both those issues, compassion fatigue and secondary trauma on the adults, will impact their ability to be effective in working with kids. And there's the old saying, you got to be at your best to give your best. And our kids deserve the best, right, of all of us. So if you're a leader in your organization, in your school system, be thinking about how do you support the adults, both the certified staff, your teachers, your principals, all those folks, but also the classified staff, your bus drivers, your food service workers. Because in many cases, it's the classified staff, the food service worker or the office worker or the janitor, many times they're the ones who have the best relationships with the kids. So don't forget supporting all the adults in the building, okay? And doing training, but also recognizing they're in all likelihood, there's a good number of your staff right now who are in abusive relationships, yet they come to school every day and give their best for kids. So being sensitive to changes in our colleagues and how we can support them. If I'm on your team as a fellow teacher, or I'm an assistant principal, what resources do I know that are available for the adults in addition to what's available for the students is really helpful. So let's turn it over to our community partners. And if from a pediatrician's perspective, Dr. Mitchell, if you can say a few words.
Sure. I want to examine and explore more a framework of screening implementation that really works for families, that really benefits them, that they recognize the benefits. So one that enlightens and encourages and emboldens them both to understand the practicalities of the science and their unique experiences, but also to recognize the resources to build resilience. So right now I see barriers to the screening process in a doctor's visit just because of the trust that has to be there to disclose that information. So I think, questions that really require further discussion would be, why do people need to disclose that vulnerable information to get their, or before their needs are met? Is that really necessary? And can we offer the same level of care, respectful, optimal, evidence-based care, while explaining the science behind it and general principles, but not having them have to disclose? And I know with Dr. Burke-Harris, she kind of addressed that by filling it out, but not disclosing the specifics. But in a doctor's office, there's often lots of forms to fill out. So there's a form fatigue and other potential barriers there, that so it just, sometimes we've had experiences where the filled out form is 0, and just in talking with the family, it's clearly not 0. So again, just really trying to develop a framework that truly meets the goal, which is to provide families with that education and the resources they need, that it's not about documentation or research purposes or anything serving the system, but really serving the families. And then secondly, to continue to work on sustainable community collaboration, community partnerships. It's so exciting that ACEs and resilience, the knowledge of that is gaining such traction in the community at large, and certainly in Louisville and throughout Kentucky now, in large part due to Bounce. So that is wonderful, but I think we still struggle with silos of wonderful work being done in different organizations, but how can we create a cohesive system that where we are supporting one another and helping the organizations build resilience, but also benefiting the families more by being one having one unified approach instead of the silo effect.
Thank you, Dr. Mitchell. I think you make some good points. And anytime we do these kind of community forums and we talk about the ACEs test, well, should we give it, with kids and stuff like that, like as educators? And I have 2 comments on that. The first comment is, the best thing to do as educators, just universal precautions, just to automatically assume that all your kids have ACEs in their backgrounds. And so you just treat it from that perspective. The reason why I say that is because sometimes as educators, if we have a number, then the kid is we only see the child as that number, right? And it's just like when we do tests with kids, right? And we see how they're doing. So I'm always hesitant about, in an educational setting, about, ACEs scores and stuff like that, because we want to avoid the staff seeing the child only as a number, okay? So that's just a comment on that. So then let's go ahead and turn it over to Gloria, and then also another one of our community partners.
Thank you. That's a really good point, Dr. Bargione, to just, go ahead and treat each other with that trauma-informed approach that you and Brian and Superintendent Ford, and Dr. Mitchell's talking about is, what has happened. So, and the other thing Dr. Mitchell touched on that I feel very fortunate at 7 County Services at our community mental health center in our 7 counties region, we have great partnerships with the school systems, and we work well with Jefferson County Public Schools and Bullitt County Public Schools and Shelby County. We work really well with the public school systems. We have good partnerships that we are supporting these kids. We're also beginning to do integrated care with medical providers, with pediatricians. So we have social workers embedded in U of L pediatrics, and we just began that with the family health care clinics. I think we're going to have to do more of that coming together to really tackle this and share that same vision and dream that Dr. Burke Harris has. You know, in community mental health and in my background training, and several of my colleagues that I work with that are on this call tonight, we're blessed with that. We learned in our clinical training to help kids name the scary thing. We learned evidence-based treatment approaches to do with kids that have experienced trauma. I think the part that, you know, we can continue to grow in our field is the education piece and helping children find that one safe, supportive adult. And even if it's not somebody that they live with, who can be that safe, supportive adult for them, and helping them identify who that is and helping them grow that positive relationship. I think in my role, I get to do a lot more clinical supervision. I'm blessed sometimes to help with our child crisis line. And on New Year's Eve, they needed somebody to work. And so I worked, and a 9-year-old girl called our crisis line at 11:15 at night, scared because gunshots were going to be going off at midnight to celebrate the new year. And what if they came into her home? And, you know, it's heartbreaking, some of the work we do and the things that the children we serve experience. And it just reminded me how important that is for the person that is this clinician of this child and her family, that they go over the adverse childhood experiences and how they affect children, and that children do have stress too. This young lady, when I was talking to her, this 9-year-old girl, she was telling me the only other person awake in her home with her was her mother, who was drinking alcohol, and how just unsafe she felt. And these are some of the experiences the kids that are being educated, and I saw in the chat, that are taking these standardized tests that teachers feel so much pressure for their kids to perform on. You know, in the film, it talked about how if we can identify ACE scores and educate on resiliency and the factors that increase resiliency and create buffers, we're going to see a decrease in suicidal ideation, a decrease in domestic violence, a decrease in violent crime. It didn't say that we will see an increase in school attendance. We will see an increase in scores and kids' grades going up, and positive social, emotional relationships. So those are the things that we have to look forward to. And I have been fortunate when Bounce started to hear of how they were doing in several different schools in Jefferson County Public Schools, and how they were helping and affect not just the kids, but the staff, the cafeteria staff, the bus drivers, everybody that touches a child, and how they educated them on their own childhood experiences, but also on going ahead and making that assumption that every child you encounter needs you to come with that trauma-informed approach. So I agree with Dr. Bargione. We need to stay involved with policy and advocacy, and Shannon Moody's on here. She can help you with that. If you need Kentucky Youth Advocates to help you with what to say and when to do it, they're really great about sharing that information about policy that's coming out in Frankfurt and things that we need to advocate and get behind. And a lot of times they'll even create the letter for you. You just have to sign it and send it in. But I know everybody that's on here that's giving their Thursday evening has the same vision and dream as Dr. Burke Harris, that we want to be able to say in our lifetime, back in the day, these toxic stress things happened, and look at everything that we all came together. You know, our generation came together, your generation came together to create to decrease that. And my last thing I'll say is, I think another thing that we all have say over is the children in our lives. So I always say to my kids that my goal is they will have an A score of 0. And I really, I said, that's my goal, and that you can't write a country song. So, we can all do that. I love country music, but, I don't want my kids having to write some gloom and doom country song when they grow up. And that's something, even if you don't have your own children, you can do to affect the lives of other children. So thank you all for having me.
Thank you, Gloria, and thank you to the panelists. I know we have a number of questions in the chat box, but I'm just going to, at this point, just pick one and see how time goes, because we want to leave a little bit of at the end, and we want to respect the 6:30 timeline, because I know many of you folks have been working, right up first thing in the morning. But the one question, and it's really kind of talks a little bit about the ACES events, and Dr. Mitchell talked a little bit about, we have the 10 ACES events, but then also with racial trauma, in our communities here in Louisville, but across the state, the country, with what's going on with the racial trauma and the inequities and those kinds of things. We have our own experience with Breonna Taylor here in Louisville. But can you maybe talk a little bit about, in your organizations, whether it's in the Smoketown Family Wellness Center or at 7 counties, or Michael or Brian, if there's anything around racial trauma or like supports or services, how you might be doing things a little differently, taking into account the racial trauma. If you want to learn more about, there's more ACES events. The original study had the 10, but there's some work going on from the Philadelphia where they actually include community events as ACES events, kind of broadens away from just the 10. So if you want to learn more about that, you just type in Philadelphia study ACES, and you'll learn more about more of those community events. So, but if we can touch upon a little bit about the racial trauma that's impacting many of our kids and our families, but even our staff. Julia or Gloria, do you want to jump in first, or do you have any comments for that?
I was looking for the gentleman's name. Maybe you can help me, Dr. Bargione. One of the things that we've implemented at 7 counties is a leadership training. And there is a psychologist at Spalding. He's a teacher.
Yeah. If you want to learn,
Dr. Nifley?
Stephen Neffley is a psychology professor at Spalding, and he's doing a lot of work in this area around racial trauma. He does trainings and stuff like that. So we see the link, his name there. So.
Yes. Thank you, Shannon and Jen Treskel. Yes. So he has been doing some trainings for our leadership staff. And so that we can, because we all know it trickles down, and so that we can be the good leaders in this area. And, one of the things that I've noticed that's come up more and more, and Dr. Jackson's on here too, that I've been really impressed to see that families, when they are calling in or they're going to our website to request an appointment, they're asking for the therapist they want. So we've had several parents request an African-American therapist, a Black therapist for their child. And there is a great need. We need more men clinicians. We need more ethnic diversity clinicians. And I think that was another thing I loved about this film was Dr. Burke Harrison being a Black pediatrician serving in her community. Families can relate and feel comfortable with her and sharing their experiences, and also see a role model. And that's the same thing we need in mental health. And I'm always encouraging young people that are telling me they're interested in this field, to reach out to me, reach out to other people who've meant something to them in this field, and let's mentor them up, because their life experience, we've seen through peer supports that work in our organization that have lived experience, that are in recovery themselves, make such a great impact on the clients we serve, because they can say, I was homeless, I was using drugs, I was on the street corner, I had no one, I dropped out of school. And let me tell you what's happened, that I participated in my therapy. I took my medication as prescribed. I did detox, medical detox. I did residential treatment, and I'm living recovery now. And let me tell you about my life and my job and my reconnecting with my family and my children. It's really powerful work. And we even have youth peer supports that are helping younger individuals that they got that advancement early on. So that's another avenue that I've found has been really powerful.
Just the one thing about, I think you bring up a good point, Gloria. Just seeing people like me, right? It's really important. And it was so nice to see in the movie itself, when they were opening the youth center, the Youth Wellness Center in Bayview, the Bay Ridge area of San Francisco, one of the speakers was the Vice President of the United States.
Yes.
Right. And so we saw that. So I think that's really important. But I don't want to move away. Talking about racial trauma and the racial inequities, that's something, it should have their own training. In fact, that's one of the things Bounce is looking at, is actually just doing a training around racial inequities and racial trauma. But if the three other panelists, if you want to say a word or two around the racial issue, please do so, because I want to leave a couple minutes at the end to turn it over back to Chrissy Jones with OVEC, and she'll close it out. Because like I said, I want to respect your time and end at 6:30. But for any other panelists, you want to say anything else about?
Joe, I'll just mention
racial
in
issue?
Russell County, me and another superintendent, we had arranged for Dr. Damian Sweeney, I know you all know him, with KDE, to work through our co-op and provide a training. And I really wanted to focus that first with my administrative team. So the expectations and just training and let that go down. But, you know, I'll say, and then I'll hush, you can't be hesitant to have those conversations with minority groups. And so it's okay to bring a parent in, an African-American parent, and sit down and talk with them and say, what did we do good for your child? You know, what issues did you experience? And just be honest and blunt with them. And I think folks are appreciative of that. And you go into that with an open mind and just willing to learn and do better, because, you know, the idea that says that, you know, I don't see color is certainly not fair. To appreciate what a minority group may suffer or go through. So Dr. Sweeney does a great job too with his training, his resources. And
for the JCPS people, he right now works at KDE, but he did much of his career as a high school counselor in JCPS before he moved over to KDE. But any other 1-minute comments from either Brian or Dr. Mitchell?
So, I mean, we definitely want our staff to represent our community. We are short-staffed right now and are looking for a medical assistant, an office manager, a social worker. We would love for those positions to be filled by people of color. So that's one, you know, intentional thing to pursue. And then I think just having candid, compassionate conversations. I cannot imagine what my families have gone through, but I can care, and I do care, and I can communicate that and hopefully build trust and rapport to try to provide support in that way.
Okay. Brian, did you want to add anything?
Yeah, I think, you know, we've just tried to give our students a platform to be listened to. A lot of times we've had kids that just say, we don't feel like we're ever listened to. So, you know, we've been intentional about providing that safe space. I've been very intentional of just help me understand things, educate me as well. And a lot of our students have really, you know, they've talked a lot about how they've enjoyed being able to come in and educate me a little bit, and also feel supported through that process.
Well, before I turn it over to Chris, I just want to thank the panelists for their insight. Much appreciated on that. But then also to you folks, You didn't have to be here, and you came here after a long day. The most important thing anybody can give someone else is their time. So for everybody here this evening, thank you for sharing your time with us. Balance, we're here for you as we're partnering with KYA, and think in terms of this is going to be a journey for your organization, for your school system. And everybody's at a different part of that journey, but it's going to take time, but you have to take the first steps. And if there's anything we can do to support you, please let us know. And I'm going to turn it back over to Chrissy, and I think she's going to a few closing comments.
Yes, thanks. Thank you, Joe. And I want to mirror your comments. Thank you to the panelists. Certainly appreciate your time and your insight. I thought it was very, very valuable. I enjoyed the documentary. A lot of takeaways with that. And I want to thank everybody for sticking with us. It is a Thursday evening. It's 6:30 at night. It's dark and you've had a long day, but yet you're hanging right there. So I truly appreciate that. We are really looking forward to our work with Bounce. Our goal is to help our school districts, to help our school communities. When you look at the 15 districts in OVEC, we could affect up to 155,000 students. When you look at the collective number of students that we serve, and about 20,000 plus adults. So we have the opportunity to have an impact on a large number of students and adults. One of the things when we first started looking at working with Bounce, we do a lot of one and done that I call, you do this training, then you go on and you don't ever come back and talk about that training. So we wanted our group that is kind of overseeing this, we wanted to make sure that what we do, it could be continued. We do have some grant money now, and that's permitting us to take the initial steps, but what can we do to ensure when that money's gone that this work continues? So one of the things that Bounce does provide is they have a Train the Trainer Institute, and that will be one of the first things that we do undertake, and we'll be contacting our districts to ask them to identify one or two people who would be interested in providing that training. We'll try to have somebody at OVEC because, when you do this type of training, it's better to have two versus one. So that will be our initial step. We'll be train the trainers. We'll be working with our districts to help them identify maybe what they would like to focus on, and then we'll go from there. We also will be, and I think, Joe, you were talking about the trauma-informed plans. These are due from the districts by July 1, and we want to provide some support to our districts in developing these plans. So we have asked the Bounce Coalition, and they are willing to do this. So that information will be going out to our districts too, probably within the next week or so, about providing that support to make sure that the plans they develop are plans that really will have an impact. We know what trauma is about. We see the effect of trauma. And honestly, I think with the pandemic, it's going to be even more critical than and we're going to have more people. I've said I think everybody's going to come back with PTSD because of what we've experienced. So, but I don't want to keep you. It's 6:29. I'm watching my clock, but just to kind of give you some information on our next steps, and we will be communicating this to our districts and to the different row groups. I'm pretty notorious for sending it out to everybody on the food chain. So, but if you have any questions or you want more information from our work with, and we do work with Greater Louisville Education Cooperative, feel free to reach out to me. You can find my email and stuff on the OVEC website, ovec.org. But we're looking forward to our partnership and the benefits it will have for our school communities. And again, thank you all for being with us tonight.
Have a good evening, folks.
Yes, go eat some supper.
Thanks, everybody.
Yes,
Woo!
thanks.
Thank you.
Mhm.
Thank you.